Hey everyone, this is Nurse Kristen again for another Sunday edition with our chat. I would like to welcome everyone. Hi Jean, hi Jasna, I see that you guys are on here. We're getting some people joining in. Today is a special edition, an even specialer edition of our Sunday chat, because today I have Dr. Brian Copley with me from Pfizer. And Dr. Copley is one of the lead nephrologists, if not the lead nephrologist, that's working with Pfizer on their PODO trial. So I'd like to introduce Dr. Brian Copley. He has been with Pfizer as a contractor with them for about the last year and a half, working specifically on the PODO trial, FSGS clinical trial. Prior to that, he has been a nephrologist for many years in places such as my hometown here in San Antonio. He's been in Louisiana at Ochsner. He's been at the Cleveland Clinic. Most recently, he is living outside of Philadelphia in the suburbs, close to our Nefcure home. So for now, what I would like to do is introduce Brian. Brian, thank you so much for being here with me today.
It is totally my pleasure. Thank you.
Yeah. So let's just get started. I would love if you want to go ahead. I know you have a little bit, some screen sharing. You'd like to go ahead and get that going and talk to us about the PODO trial from Pfizer. There's been a lot of talk about Pfizer recently, but today we're going to really focus on the PODO trial that's designed for FSGS patients.
Okay, well, thank you very much. And I am going to Are you able to see my screen?
Not yet. Let's see.
Not yet.
Not yet.
Okay.
Hi, Tara. Hi, Linda. Tracy, thanks for joining us today. All right, here we go.
There we go.
All right, Brian, I'll let you take it over. And when you're done, stop share and we can have a conversation. I do want to tell people that as you are presenting, if you have questions for Brian, please go ahead and drop some questions in the comment section here on Facebook, and we will answer as many as we can when he's done.
Well, thank you. And again, it's an absolute pleasure to be here. And I'll be talking to you about the PODO trial. And what you're seeing is the title of the trial that's quite formal, but it's a study to evaluate, the number is the study drug, in adults with focal and segmental glomerulosclerosis. And what we're going to be doing over the next several minutes or so is discussing what is FSGS. We'll also discuss specifically the PODO trial. We'll segue into the Nefcure gateway, and then I'll finally end with providing you with more information about PODO trial and how you can obtain more information about this trial. But I also look forward to your questions at the end of this presentation. So to begin, what is focal and segmental glomerulosclerosis? Well, first of all, FSGS, which is the abbreviation, is a rare kidney disease characterized by dysfunction of part of the kidney that filters blood. In other words, the glomeruli. Only some of the glomeruli are affected, but continued damage can lead to kidney failure that ultimately may require dialysis in the form of hemodialysis or peritoneal dialysis or transplantation. Now, to break down the term FSGS, focal means some, and we're talking about the glomeruli. So initially, when the process begins, only some of the glomeruli are involved. Segmental means that if you take an individual glomerulus, only a part of that glomerulus or a section of that glomerulus is involved with the process. Glomerulo means of the filters. And again, these are the small filters within the kidney, and there are about 1 million in each kidney that filter blood and ultimately lead as a result of that filtration to the production of urine. And then sclerosis means scarring or damage. The exact cause of FSGS, especially the primary form, is unknown and it's not precisely understood. We think that individuals who develop this disease may evolve and develop something called a permeability factor, and that this permeability factor damages the filters of the kidney, the glomeruli, and allows them to filter substances that ordinarily they shouldn't be filtering. We also know that genetic and environmental factors may be associated with disease as well. Common main symptoms. One of the most common is protein in the urine. And the amount of protein is closely associated with progression of kidney disease. So in other words, the more protein that you have in your urine, the more rapid your kidney failure may progress, and the more involved your kidneys may be with the scarring process. FSGS is also associated with severe swelling. As a result of the loss of protein in the urine, to include a protein called albumin, the blood vessels within the body lose their integrity, and this allows them to leak. And this leakage causes swelling. And potentially this swelling can be throughout the body, but it usually presents with swelling in the legs to begin with. A progressive loss of kidney function, and that progression occurs over a period of about 9 to 10 years. And then unfortunately, if a person receives a kidney transplant and their underlying disease is FSGS, there can be recurrence in that transplanted kidney 30 to 40% of the time. So that really points to the need to have a primary therapy for the original disease. How rare is it? Well, it's estimated that in the United States, there are about 40,000 patients with what we call primary FSGS. And that would be FSGS that's not associated with a secondary cause and that very likely may be associated with this permeability factor that I mentioned before. Also, there are approximately 20,000 patients with end-stage kidney disease due to FSGS. Glomerulonephritis is only one cause of end-stage kidney disease. However, of all the forms of glomerulonephritis in the United States, FSGS is the most common cause of end-stage kidney disease. And unfortunately, with current therapies, over 60% of patients do not have a durable response to treatment. And as a result of this, they tend to be treated with one drug initially, but then ultimately multiple drugs. And roughly 1,000 FSGS patients receive a kidney transplant each year because of the end-stage kidney disease due to this entity. It's important to note that when we talk about the Federal Drug Administration in the US, that there are no approved medications for FSGS. The standard first-line treatment for FSGS is a corticosteroid called prednisone. And then second-line treatments include drugs such as MMF or mycophenolate mofetil or calcium urine inhibitors such as tacrolimus or cyclosporin. So the purpose of the PODO study, the phase 2 trial that currently is sponsored by Pfizer, is to evaluate the safety, which I'm going to define in a minute, tolerability, which I'll also define, and efficacy of the study drug. and then there's this long, fancy letter and number, which is the Pfizer term for the study drug. In patients with FSGS, to determine how well the study drug works at reducing protein in the urine measured by something called the urine protein creatinine ratio. And I'll define that in just a minute as well. And this will help us understand if the study drug may improve kidney function in patients impacted by FSGS. After this particular trial, an additional trial is going to be required with many more patients to, again, solidify our understanding of how the drug works and also to solidify whether or not the drug is effective in treating FSGS. When I talk about the glomerulus being damaged, what I'm showing you in this cartoon on the left side is a normal glomerular capillary. And capillaries you might think of them as a tube, and the inside of that through which blood flows is called the lumen. And the purpose of the kidney, as I mentioned before, in the glomerulus is to filter the blood. And so the kidney is composed of, if you can see my arrow, little endothelial cells, something called glomerular basement membrane, and then on the opposite side, something called podocytes, and the filtration slit. And so the flow of molecules is shown in this cartoon through the endothelial cell and out into this space, which ultimately passes and allows urine to form and be passed from the body. But when this permeability factor that we think causes primary FSGS occurs, this damages these podocytes, and as a result of this, causes fusion of these podocytes and collapse so that they lose their normal structures as shown here. And substances such as albumin, which is a large protein that should stay within the glomerular capillary and within the body, are lost into the urine and passed out of the body into the urine. And albumin is one of the major proteins that is lost in a person with FSGS and is part of the proteins that constitute proteinuria that's associated with FSGS. What we're hoping is that the study drug will affect directly these damaged podocytes that you see here and make them look more like the normal podocytes that are seen here. And as a result of that, that proteinuria will be reduced and that the progressive loss of kidney function will be curtailed. Now, the definitions that I promised you, safety, and that's paramount in this study. And we look at safety to ensure that our drug does no harm to the patient and that the benefits of using the drug outweigh any risks associated with the drug. So we monitor continuously side effects that occur as a result of the drug in the study. Tolerability, how well a patient who is taking the drug can tolerate the drug. It's an assessment of how the drug is administered. It's an assessment of what occurs to patients taking or receiving the drug, side effects related to the administration of the drug. In short, it assesses a patient's comfort with treatment. And then efficacy is how well the drug works. In this case, reduction in the amount of protein in the urine. And again, as I mentioned before, when we reduce protein in the urine, we think that this will cause stabilization of kidney function and that this will reduce the rapidity with which the kidneys might fail in this disease entity. In this study, we're measuring urine protein by a ratio of the urine protein to urine creatinine, which is a simplified method for determining how much protein is appearing in the urine of the patient. With reference to our study in particular, we have something that we call inclusion criteria. These are criteria that you have to meet to be allowed into our trial. Ages greater than or equal to 18 years of age. So thus far, we are not enrolling adolescents or children into our trial. We also are looking for FSGS without a documented secondary cause. And we have something called exclusion criteria that will exclude patients that might have a secondary cause of FSGS. We have proteinuria requirements. Again, going back to the urine protein to creatinine ratio, greater than 1.5 gram per gram. And this correlates to about 1.5 grams of protein in a urine that is collected over a 24-hour period. We also want individuals who are not treatment naive. In other words, we want patients who have been treated with something for their FSGS, but who have failed or who haven't responded to that treatment. So we ask that they be treated with at least one, but no more than 3 classes of immunosuppressants. So for example, that would mean a patient that had been treated with corticosteroids, like prednisone, a patient who had been treated with a second-line calcineurin inhibitor, like either cyclosporin or tacrolimus, and then thirdly, third-line treatments such as mycophenolate mofetil or MMF. A brand name for that, one of the brand names, is Myfortic. Or intolerance or a contraindication to an immunosuppressant. And that would be up to the doctor that is taking care of you or trying to enroll you into the trial. But for example, if you've been treated with prednisone and didn't tolerate it, or if you'd been treated with cyclosporin and didn't tolerate it, then you could qualify for trial. And the same would be true if you had a contraindication treatment of any immunosuppressive therapy. We ask that your kidney function, measured by something called an estimated glomerular filtration rate, be greater than 45. And that's fairly generous because once your kidney function is at about 45, you've already lost about 50% of your kidney function. We also will allow more severe kidney dysfunction if you've had a recent biopsy within a year and if your eGFR is between 30 and 45. And again, when we talk about eGFR, the lower the number, the worse your kidney function. Main exclusion criteria, something called collapsing FSGS. FSGS is a kidney biopsy diagnosis. And the Columbia University in New York City, which is a very prominent glomerulonephritis institution, has categorized different types of FSGS. And their categorization includes 5 different types, one of which is collapsing. And we are excluding patients who have collapsing because its course tends to be relatively rapid to total kidney failure compared to other types of FSGS. We also are excluding patients with significant comorbid conditions. That means patients who have very severe heart disease, patients who have type 1 diabetes, patients who have other diseases that might interact or influence their ability to respond to the drug or complete the trial. We're excluding patients in this trial who have had an organ transplant. So patients who have had a previous kidney transplant are not allowed into the trial. Patients with an active serious infection are not allowed into the trial. One of the secondary causes of FSGS, for example, is AIDS. And because of the way AIDS impacts the kidney, and because of the fact that it often is associated with collapsing FSGS, we're excluding serious infections such as this. We're also excluding patients who are pregnant, we're excluding lactating females, and we're also excluding women of childbearing potential who are either unable or unwilling to use contraception. Now, a major feature of the trial is in the upper right-hand box. This is a phase 2 open label trial, which means there is no placebo, there's no control. So patients in this trial will act as their own control. We're attempting to enroll 44 patients in 2 different cohorts. The drug is administered every 2 weeks for a total of 12 weeks total. I'm going to move this out of the way. There are 7 visits over the 12-week treatment period, and then 4 follow-up visits over a 9-week period. And currently, and this is an ever-changing statistic, we have we've approved 79 study sites in the United States, Canada, Japan, and rest of the world. Now this says 14 countries, and that was correct when the slide was made, but now this has been reduced to 12 total countries. Currently, 16 sites are actively recruiting. That was true when the slide was made, but actually now there are 18 sites that are actively recruiting. 15 of those are in the United States, 1 is in Canada, and 2 are in Japan. And again, we are rapidly recruiting studies or study sites, so this number will increase over the next several months. Study duration is as outlined in the boxes. There are 2 cohorts, each of 22 patients. The only thing that differs is the amount of study drug, and these cohorts are enrolled sequentially. There's up to a 39-day screening period, and then after the screening period, there's an 8-week lead-in period where laboratory tests are accomplished that provide baseline laboratory tests for each patient. And then the patient receives study drug in 2 different doses, higher dose first for 12 weeks, and then the second cohort of a separate 22 patients will receive the lower dose for 12 weeks. And then they're followed up for a period of 9 weeks. And it's right at the beginning of the follow-up that further testing is done. Compare what happens to urinary protein after the drug is received compared to what happens prior to the administration of any study drug. I want to point out that Pfizer is a very proud sponsor of NephCure and of the Gateway Initiative. Kristen, I'm sure, has talked extensively about that. The Gateway Initiative is an innovative strategy to improve nephrotic syndrome clinical trial recruitment. And then finally, how to obtain more information about the PODO trial and FSGS. One can go to the Kidney Health Gateway, and the link to that is included on this slide. One also can go to clinicaltrials.gov, and the link to that is shown on this slide. There's a number that can be called to gain more information about the trial. And then one can also email Pfizer, clinicaltrials.gov inquiries@pfizer.com to obtain more information. So that is a very quick overview of our clinical trial. And I'm going to stop sharing the screen, and I'll be happy to answer any questions that you might have about our trial going forward. And I thank you for your time.
Thank you, Brian. Thanks so much. I tell you what, we've had some great engagement on Facebook, so I am so glad to see all of these people here and watching, and I appreciate your time today. I have a few questions for you, Brian. So when someone goes into a clinical trial, who do they see for their nephrology care? Do they still see their regular doctor, or do they just see the doctor in the clinical trial?
It's really going to depend upon the arrangement between their own doctor and the study trial doctor. Definitely the patient has to see the study trial doctor because he's going to be monitoring that patient, and also he's very familiar with the study drug, side effects that are potential for the study drug, and so forth. However, in most instances, there's a dual follow-up. And at the end of the clinical trial, the patient is returned to their primary doctor with full information about the trial and how the patient responded, so that their own doctor is kept up to date.
So let me ask you a little bit more about that. So if I'm in the trial and I get lab work done, am I able to get a copy of that and send it to my doctor, or does it just need to wait until the end?
No, actually a copy can be sent to the referring doctor, because obviously that doctor is going to be very interested. It won't be everything, but it'll be the common drugs that primary doctor, that primary nephrologist draws on the patient as well.
Oh yeah, that's good. That's really good to know. What if I'm in your trial and my kidney function changes? Obviously, we're looking for a positive change, right? We're looking for a reduction in that protein in the urine during the trial. That's what we're hoping for. So if that happens, do I get to stay on the medicine, or do when the study's over, does it stop and I have to wait for the medicine from my doctor? How does that work?
Well, this is a phase 2 trial. Mm-hmm. And again, the primary purpose is safety and tolerability and an indication of efficacy, which is how well the drug works. So because this is a phase 2, unfortunately, after completing the trial, receiving the 6 doses and having the follow-up of 9 weeks, no longer will the study drug be initiated. In the future, we're considering something called a long-term extension, so that patients might again receive the study drug. But as it stands right now, after receiving the drug for the 6 doses, that unfortunately is it, assuming that the drug works.
So if you move into a phase 3 and I was part of your phase 2, could I join again?
Very good question. And that decision hasn't been made. Many times it would probably require a long-term extension trial rather than moving into a phase 3. But those minor details haven't been formulated yet for the phase 3 trial.
So what we need are for people to be interested in listening to this webinar today and for joining and putting an inquiry into the PODO trial so that we can see what this novel PS numbered drug, and how it works in people's kidneys who have FSGS. So that's really good information. So sometimes, I'm a part of some Facebook groups that are around nephrotic syndrome, FSGS, that sort of thing. And sometimes people will ask, have you inquired or have you asked about the PODO trial? Have you asked, or is anyone in the Pfizer trial right now regarding the PODO trial? am I allowed to say, yeah, I'm in there? If I am, I mean, if I am in the trial, am I able to tell people that I'm in the trial?
Absolutely. There's no reason at all that a person can't tell another individual that they're in the clinical trial.
That's interesting because I say that because sometimes peer support and communication between peers is pretty important, especially in a rare disease population. I think a lot of times the peer-to-peer support can be almost as impactful as a good relationship with their doctor as well. So that's good to know that people can share that they are in the trial or that they're curious about being in the trial. You know, one final question, and then I want to make sure that people have a chance. If you're interested or have any questions about FSGS, the PODO trial, or clinical trials in general, if you have anything for Dr. Copley, please make sure you drop those questions down in the comment section. But one final question for you. What are the benefits for a patient to look into participating in a clinical trial? How do you see this as a benefit for patients?
It is obviously critical to the study of any drug that it go through a series of phases to ultimately be developed and approved. So will an individual benefit directly? I suppose there is the possibility that by receiving 6 doses of the drug, if it works, and if protein is reduced, that reduction in protein may be sustained. But right now, we don't know that. And that's what we're attempting to determine. So direct benefits to the patient, probably more because they're on the cutting edge of receiving a therapy for a very rare disease.
Yes.
But direct benefit, it's hard to say right now.
Yeah, but I do think that there's a big impact with what you're referring to as far as this holistic picture around nephrology right now and the innovation and the research that it took to discover this molecule that obviously is being studied in the PODO trial and the impact that could actually have on our community. And there's a lot to say around the, urgency and I want to say immediacy about filling some of these trials so that we can find the first FDA medication approval for FSGS. I think it's also important to mention that there's probably not many drugs out there that have not gone through clinical trials to be approved, right? In all disease states. And so while nephrology might be a little behind, we have made strides, right, in the last 5 to 10 years. And what Pfizer is doing is remarkable. And I hope that people have enjoyed and taken some good information from you today. And I do appreciate you being here. This is really one of the first ones like this that I've done. And I really am proud to say Pfizer is the first one. So with that, I want to thank everyone for being here today. Dr. Copley, thanks so much. I appreciate you. And I appreciate the Pfizer company and everything that you guys are doing to advance medication and advance the health of our rare nephrology community. I really do.
Thank you so much. And we are honored to be you first.
Yes, it's great. It's really, really great. Thank you so much. Have a wonderful Sunday, Dr. Copley. Thanks everyone for being here. Remember, please go to www.kidneyhealthgateway.com. You can submit an inquiry today for the PODO trial. You can find the closest one near you, and we hope that we can answer any questions. Please also feel free to email me as usual, khood@nephcure.org. I'm here every day for you, so feel free to email me and check us out on nephcure.org as well. Happy Sunday, everyone. Have a great Happy Hanukkah, Merry Christmas, and Happy Holidays.